morning, everybody. It's Dr. Herzog with episode number, I don't know.
6.
Today, 6. Okay, so today we have a lot going on in the schedule, and like always, I'm juggling a million different things. We're doing implants, we're doing extractions, bone graft, we're doing deliveries, we're doing overdentures. We've got all on 4 cases. We've got, I don't even know how many new patient consults. So you'll see me doing just a little bit of everything, and I would love to kind of jump in over all of these things and explain to you what I'm doing so you can actually see the process and understand it. And then maybe if you have questions about a process that you're having, you can comment below and I'll answer your questions. So some of the things that we're doing today that you will be able to see for sure are placement of a couple of implants in a narrow ridge. So this is someone who has not a lot of bone. And some other things are some overdenture cases, so snap-on dentures. One of the cases, a patient who came last week, so maybe you'll see her again this week. And typically, the Tuesday patients that are scheduled one Tuesday, they come in the following week on another Tuesday. So you might see some familiar faces there as well. It is the holiday season, so we're gonna decorate today, and we're gonna get lots of stockings, and I'm gonna start putting the stocking stuffers in for my wonderful staff. And we're getting ready for the holidays, so we've got our holiday lunch coming, and our party, and lots of presents and goodies, and I can't wait, and I'm looking forward to it. So here we go. As you can see, this is the patient from last Tuesday, and I had placed some temporary attachments, and here I'm changing them out to her permanent attachments, which she'll wear for the next year or so until they get loose and we switch them out again. She can now eat her food and chew and function properly. This is just a 5-minute appointment, and I'm basically showing her how to use the denture, how to clean it, how to place it in her mouth, and how to take it out. And it has a great amount of retention. So theoretically, we could hang something that weighs 4 pounds on her denture. Okay? Okay, bye, Elena. Happy holidays. Feliz Navidad.
Ya, la doctora lo guardó. Eso se lo puede dejar a la muchacha abajo de la tienda que a veces necesita.
Sí.
Para que te llame.
So she says that her life has changed. She's a different person. She wants to cook. She wants to eat. She wants to go out. She invited all her family over for Christmas, which she hasn't done in years. She wishes that she would have done this sooner. And that's really nice to hear. So now in this patient, we're actually going to be doing extraction of a lower premolar and a lower wisdom tooth. And this is a patient who travels the world teaching implant dentists all over the world. And so he comes to our office, which is such a nice compliment. And so I can do his extraction. So you can see here, I'm elevating the tooth. And I do this to loosen the tooth a little bit. Sometimes you'll feel some pressure on the front teeth when we're doing this. And then I'll take the forceps and rotate the tooth a bit until it comes out, just like that. The socket is then cleaned with a curette, as you can see now. And then we irrigate it or wash it with a disinfecting solution called chlorhexidine or Peridex. That is me mixing the bone there. And I mix the bone with a saline solution. And that is because the saline is not toxic, it is sterile, and it is safe for the body. It is the same pH. And so basically this bone graft material, which is like a powder, is then placed into the socket and condensed down with that instrument that I'm using, which is called a condenser. So you can see Annie placing it into the socket and me condensing it. And I take a little 2x2 gauze to dry off some of the blood and condense it down a bit more. And now we're taking out the wisdom tooth. And so again, elevating the tooth until it just gets nice and loose. And then I'll take my forceps in just a second, you'll see. And with the forceps, I can just basically get a hold of the tooth in order to remove it. And in this case, the tooth came out rather easily for a wisdom tooth on a middle-aged person. So in that area, we're not going to bone graft, we just clean it out, and then I'm going to place just one suture in that area just to keep it nice and clean and so the patient is a bit more comfortable. And this suture should fall out in about 24 hours.
Or how about here?
Oh, great idea.
There. So I'm going to move that to here,
Yeah.
both of them, and put the table there with the tree. And then I have, oh my God, I have so much. I have a different So
Sad.
these go out. Yes, so sad.
And
then-
usually I give that away at this point.
No, you don't give it away.
I do, I give it away.
Okay, I'll take it home.
Yeah.
Sure, I'll take it home.
I don't throw it away, I give it away. And then I get a new one. And everybody gets an Implant Center of Miami orchid. Oh my God.
Okay, so first we have to put the legs on the table. I just went to Home Depot.
Ay, qué lindo.
So
A mí
funny.
sí me gusta
I went to
arreglar.
Home Depot. Oh, I have tons of stuff. Deja que vea todo lo que traje. I have hats and stockings and so many beautiful things.
Awesome, so now you guys get to see the procedure where I'm placing an implant in a narrow ridge. And we're not gonna show you the up close and personal here, but it's really important to know that when a dentist is placing the implants that you have enough bone. So in this case, the patient had just enough bone. And when you have a case like this, it's really important to have a very skilled practitioner placing your implants, because one small mistake and you can lose that narrow bone that you do have. So in this case, and in some cases, I'll take an x-ray in the middle of surgery just to make sure that I'm in the perfect position. And sometimes I'll even take a CT scan. So I always open up the bottle with my bare hands and then take out the sterile part. Then I'll go ahead and don some gloves, and that is the actual implant that you see on my handpiece, which is so cool that you guys get to see this. And then I'll reflect the tissue and I'll place the implant, and the patient only feels pressure at this point. You don't feel any pain of any sort at this point. So I'm going and placing the implants, and they have a nice strong torque, which is why they only go in halfway. And then I'll take my hand torque and I'll actually take a torque wrench, just like a mechanic, and I will torque it down all the way down to the bone level and put the cover screws, and that's me putting the cover screws on. And so I always suture it up and we're done. So this is a great case. We're doing an aesthetics case. So we're removing a crown and we're doing a new crown. You can see that one little tooth out of line. We're gonna fix that with Invisalign. Those are clear braces. But here I am taking off the metal crown and shaping the teeth. And I place these cottons over the teeth so that we can dry some of that blood there and get a great scan of her mouth. And here is Juan, and Juan is scanning her mouth with the CEREC OmniCam, and then he's designing her teeth. So we get to do it right there. Oh, it's for me?
Yeah.
So good?
I don't know.
Está bueno. Se deja tomar.
Like, ding.
De ella. Se ve bien.
Yeah, she's getting
Pero-
Invisalign.
Okay, but now she's hitting.
But now, bring it out more. What?
Va a quedar
Okay.
super bulky.
But
Es- Mira que ya está.
okay. But that's not my prep, right? That's just the position of your crown.
Mhm.
Okay. Y abajo
Look
que
at the
tiene.
prep.
Right, doesn't have to do with the prep. La preparación está bajita. Now we have the crowns fabricated all in the same day, and I'm placing the crowns on, and actually in her case, I used 2 different cements so I can get the color that I wanted specifically on each tooth. Here you can see me shaping them in purple, and then there you can see me cementing it on. And so we decided to use 2 different cements so that we can actually change the color here. so that they would match perfectly. One of her teeth were very dark and the other one was just natural color. And so we were able to change that with the cement underneath the crowns, and she is ecstatic. In this case, I'm just basically adjusting what's called a flipper. Sometimes you guys might get a flipper when you're having an implant done, and this patient has her flipper and it broke right before some important photos that she needed to take. And usually my assistants will do this, but you can see I'm just jumping in and doing it myself because I love my patient so much, and you know, make it nice and right for her so she can take her photos. And this is called a soft reline. So when it's too loose, you can actually just place this gummy material right over the flipper, and then you place it in the patient's mouth and press up nice and tight and hold it there for about 5 or 10 minutes until it sets. And then you can adjust it so it can be a perfect fit in her mouth. And it's a nice gummy material, so it doesn't feel hard on the roof of the mouth. It feels almost like a cushion to the mouth. And so you can see me here pressing it up right onto the roof of her mouth. He has a significant amount of bone loss. And so when that happens, you lose the gums also. And so in this case, the teeth need to come with the gums attached. So you could see that these teeth here, it's actually with the gums attached. So when you lose bone, you lose gums also. You can see where the implants are. And then the restoration, just like that. When he smiles like this, so you don't even see all that. But just in case he does a big smile, you won't see a big long white tooth. You'll see pink, and it won't be as noticeable. Okay, so it's the end of the day and you got to see a lot of different things, from implants to extractions to two beautiful crowns on a beautiful girl. And you got to see some Invisalign, I think, and you got to see some overdenture cases, and well, I don't even remember everything that we did today. It's been a long day. It's about 7 o'clock right now, and we've been running around like crazy. I'm a little under the weather. We decorated the whole office, so we have Hanukkah and Christmas, and we're excited for the next couple of weeks to come. Usually we're not open these 2 weeks, and so I'm excited to see what happens and kind of how the staff and the patients light up during the holidays. Definitely for all the goodies we're gonna get, and I'm really excited just basically to see how these next few weeks go with my staff, which is kind of like our family here at Implant Center of Miami. So I hope you enjoyed this video. We did get a lot done today. Like always, please subscribe to my channel. Again, if you have any questions at all, you just have to comment below and I'll be happy to get back to you to answer those questions, doctors and patients alike. I hope you have a great day. This is Dr. Herzog from Implant Center of Miami. Ho, ho, ho. Merry Christmas.